Hello my dear friends, welcome to Nurses Ladder. So today in this video I came to talk about a very specific topic which is prevention of patient fall in a healthcare organization or hospital unit. So before moving into this topic, I would like to request that if there is anyone who is new to my channel and who is interested to watch videos related to nursing education, profession as well as nursing excellence related to NABH, you can better subscribe to my channel and also hit the bell icon for getting notifications related to new videos as soon as I publish them. So my dear friends, let's start this video. Dear friends, before moving into the details of this video, I would like to mention the definition of patient fall. So according to the Center for Medicaid and Medicare Services, patient fall is defined as failure to maintain an appropriate lying, sitting, standing position resulting in an individual's abrupt, undesired relocation to a lower level. So if a patient is unable to maintain appropriate sitting, lying or standing position, which may result in the individual to have a relocation to a lowered level. So it is not mandatory for a patient to slip and fall down onto the floor to have a patient fall. Okay, so many times we get confused with the concept of a patient fall. It is not mandatory for a patient to slip and fall completely onto the floor to have a patient fall. Even if the patient is come down and sit on the floor, that will be considered as a patient fall. So this is what is the definition of a patient fall. And now let's see the other part of this. Start with patient fall is one of the major adverse event which may convert into a sentinel event if it is not being taken care properly. Prevention of patient fall is one of the major topic or area of interest for majority of the NABH assessors. So as soon as your hospital is at the point of getting assessed with NABH team, you must be aware of the policies and procedures related to prevention of patient fall and how can we really prevent a patient to fall. So let's see the objectives of fall prevention. First and foremost objective of fall prevention is develop. So the term develop means here we are supposed to develop some policies and protocols to prevent patient falls. That means standard operating procedures must be laid down to prevent the patient fall in a healthcare unit. The second point is training. So without training, you cannot achieve any form of accreditation. So you are supposed to train your staff in terms of knowledge, improving their knowledge in terms of prevention of patient fall. So here we need to train our staff related to the measures we have to take in preventing patient fall. What are the risk factors which can make the patient to fall? Then specifically root cause analysis, corrective action and preventive action. At the same time, post-fall clinical management of a patient. So these are the areas where you need to focus while you train your staff. And training of the staff is not only the training of the old staff. No, we are supposed to start the training related to patient fall. We should include the staffs who are in induction training also. So we need to have induction programs at the same time in-service education programs related to patient fall prevention. And also we need to take appropriate interventions all throughout our healthcare service. So these are the main objectives of patient fall prevention. Now let's see what is the scope of this particular SOP. That means how you're going to do this. Where are you going to implement this particular policy or protocol? So it includes the scope. The scope of this particular SOP includes intrinsic as well as extrinsic factors. The first one is intrinsic factor. So which is that intrinsic factor on which we will focus more. So that is nothing but the patient. So vulnerable patients are those patients who are very much prone to have a patient fall. So this is included in the intrinsic factor. So let's see what are the extrinsic factors. The extrinsic factors include the structure and the process. As you might be knowing, structure includes the physical infrastructure of an organization, healthcare unit. At the same time, you need to check the process also. So process includes the techniques, the procedures which we use while we care for a patient. So is there any damage? Is there any problems with the procedures which we carry out, which may make the patient vulnerable to have a fall? So these are some of the processes which we need to check while we check for prevention of patient fall. So these are the areas where we use the SOP related to patient fall. So that is all about the scope. Now let's see the roadmap for prevention of patient fall. So these include, there are some elements in this roadmap. The first one is fall prevention, second fall precaution, then assessment of fall risk factors, then assessment and management of patient after fall. So these are the areas where we try to focus while we care for a vulnerable patient to prevent the patient from having a fall. So first of all, let's see the first element, which is fall prevention. So we need to have safe path and zone. So we need to check on the hospital floor, the patient care units, whether any spill has happened. Okay, so if there is any spill has happened, we need to manage it as soon as possible. We need to make it clear and we need to dry the floor as soon as possible so that we can prevent a fall. And next, safety tag. So if you have not watched the video on vulnerable patients, care of vulnerable patients, which I already uploaded before, so you can better watch the video. In that I already mentioned about the safety tag. So safety tags are those tags which we use for vulnerable patients. So these tags could have specific colors, like example orange color, which we can use for we can use it in many ways. The first way in which we can use it by putting the patient tag, okay, safety tag in the foot end of the bed, so that whenever the healthcare professional comes and visit the patient, it includes the physician, nurse, physiotherapist, any of the therapists or other healthcare workers, class 4 workers, any one of them, if once they come and visit the patient, they will get an idea, oh, this patient is a vulnerable patient and we need to take care of the patient very well. So that is the first point. The second point is that you need to have a safety tag, not a tag, a sticker. You can paste it on the patient's ID tag, the ID band. You can paste it on the ID band so that the patient, by seeing this, by checking on this, you will understand that the patient is a vulnerable patient, so you will be taking care of the patient more, with a lot of precaution. And the third area where you can paste a safety sticker is the patient's file. Okay, so this is the clinical file where you will paste a particular color coding sticker, so that any of the healthcare professionals, specifically the physician and the nurses and other ward pharmacist or the therapist who will be visiting the patient, will be able to understand that this patient is vulnerable. So you need to check on all the precautionary measures in order to prevent a fall. So these are the areas where we use safety tags. And next, orientation. So as soon as the patient gets admitted to the ward, you're supposed to orient the patient as well as the relatives to the unit, okay, so that they will not be getting confused with the areas. And next, call bells. Call bells must be in function so that if the patient is in need to go to toilet or washroom or any other area, the patient or the relative may be able to call the nurse who will be there in the nurse's station or somewhere else. So the nurse will be notified by means of the call bells, which are located in the patient bedside. And next, medication review. So we need to review the medication of the patient continuously, so that to check on any specific medications such as sedative, hypnotics, or any other kind of medications which may cause the patient to have a dizziness or giddiness, which may make the patient risk at risk to have a fall. So this must be checked on. And next, restraint policy. So as I mentioned, the same thing I mentioned before itself. Like if the patient is sedated or the patient is sedated, then there is high chance for the patient to have a fall. And also you need to check if the patient is having a physical restraint. You need to check like every 15 minutes or 20 minutes if the patient has any specific need, the patient wants to go to toilet, or the patient needs some other requirement for which we need to check on, so that the patient will not get out of the bed and can have a fall. So these are the main areas where you will check if the patient may have a chance to fall. And also you need to train your staff. As I mentioned before, you need to train the staff related to patient falls, how to prevent the fall. If a fall has happened, how can you manage the patient after a fall. So these are the main areas where you will check on so as to prevent the fall. Okay, so the next area where you will focus more is fall precaution. The first and foremost area where you will be focusing on is non-skid path. So as I already mentioned, all the paths, the pathways must be skid free. Okay, and also it should not be slippery. And the second is well-defined path, means we need to label the paths. We need to have some exit, labeling at the exit and entry path, so that the patient and the relative will be able to move comfortably without any confusion. And assisted transport. So transport of the patient must be assisted. Okay. Fall prevention posters. This could be this could be hanged in the patient's bedside, or you can even hang it in the nursing station, or the areas by which the patient may be transported. So these areas could be you can use these posters in these areas. And then side rails. As I mentioned already in the vulnerable patient video, side rails must be always raised up. Whenever you are not doing any procedure, please raise up the side rail so that your patient will be at a safe side. Caster brakes. So we need to have brakes. Brakes must be on. It must be locked while a bed is not moving. Okay, when you are not transporting a patient, when the patient is on the bed, make sure that the brakes are locked. Call bells. As I already mentioned about this, we need to check every day. We need to check the functioning of the call bells. Bedside commode and urinal. So we need to make sure that bedside commode and urinal is available for the patient as per the requirement. Next is non-skid washroom, and also assist the patient. If the patient wants to go to toilet, the patient doesn't want to be in the bed. So the patient wants to go to toilet, and if the patient has a problem with giddiness or dizziness, you need to support the patient and assist the patient, which can make the patient safe from having a. Here comes the major part of management, or assessment and management of a patient fall. So let's see assessment of risk factors for a patient fall. So how can you assess a patient? It first starts with initial nursing assessment. So this initial nursing assessment happens usually in the emergency unit. As soon as the patient gets admitted, you're supposed to have an initial nursing assessment which must be carried out within the first 30 minutes. Okay, so this must be carried out within the first 30 minutes. So this will be done, and after that you can use a specific tool. The most commonly used tool for assessment of patient fall is Morse fall scale. Okay, so this is a standardized tool which we can use for assessment of a the risk for a patient to have a fall. After that, daily nursing assessment. So this will be carried out in the particular inpatient unit where the patient is admitted. It can be in a ward or an intensive care unit. Post-medication assessment, as I already mentioned about this, if the patient is on a sedative, hypnotic, or any other kind of medication such as calcium channel blockers, beta blockers. So these type of medications may make the patient to have a risk to have a fall. So you need to have a assessment checklist for that. Now let's see the post-fall management for any of the patients who had a fall recently. So within the first 15 minutes after a fall, what are you supposed to check? So you need to have initial observation of the patient. So you will be checking on the temperature, pulse, respiration, all the vital signs of the patient, GCS, CBG and SpO2. Okay, so mainly it includes the vital signs, the glucose level and also the GCS level of the patient. You will again document. So documentation includes whether the patient is conscious, whether the patient was conscious during the fall, whether the patient had any fracture, any cut injuries. Yeah, these must be noted. And also if the patient is confused or if the patient is oriented, so these must be noted. And again, after that, we need to notify the resident medical officer who is on duty as soon as possible. So that the medical officer will be visiting the client and also the officer will do the assessment. And next, you will again do the review. So this review will include a specialist team who will visit the patient and they will have a meeting. And also we need to, while handing over the patient details, to the medical officer, we can use S-bar. Okay. So this S-bar handing over procedure or checklist can be used while you notify the physician. And who and when. So we need to, while we document, we need to include the documentation part, in which we need to include to whom you have notified, who was the resident medical officer, the name and the designation of the officer, and what is the time when you notify the physician. Okay, so you need to mention this in your documentation. And you need to also mention the time of assessment. That means when you have done the assessment as a nurse, and at the same time when the physician has started the assessment. And also if there is any history of non-coagulopathy of the patient, if the patient's age is more than 65 years of age, if the patient had any previous falls, or if the patient had a fall which is more than 1 meter height, and if there is any suspected head injury, you need to go for PT, INR as well as CT scan. So post fall, you need to check certain parameters such as BP, heart rate, respiration rate, SpO2 as well as neurological assessment. Neurological assessment is usually carried out if there is any suspected head injury. So these must be measured for the first 1 hour for every 4 hours, second hourly for next 6 hours, 4 hourly for next 8 hours. So this is the way you are supposed to check the vital parameters, so that we can check on if there is any abnormalities in the patient's level of functioning. Again, we need to lodge an incident report, and also we need to document this particular incident in our handing over record, so that the next shift staff must be notified regarding this particular incident. So you can use the S-bar technique while you are handing over this documentation to the next staff. And also we need to review the patient's condition in every shift. Surgical intervention as per requirement. So these are the ways by which you will try to prevent a patient fall. You will go for assessment of risk factors by which a patient may have a fall, and also you will manage a patient who had. I hope this video was useful for all of you. If you really like the video, hit the like button and also press the subscriber button for getting more videos like this. Thank you so much for watching this video. Take care and bye-bye.